Hello everyone, and welcome. Welcome to this audio podcast. This audio podcast is part of the Haemotoxy. This audio podcast as part of Bostics and Baraga and the Specials. This audio podcast is part of the Express and the Caliber. And this audio podcast is part of a Storm Robotics production. So, through this audio podcast, a look at some bases in identifying or determining tuberculosis with particular histopathological laboratory staining investigation. This works is works that have been developed or that have been that have been drafted by science student Hussain at a particular academic institution in the United Kingdom. And so, in on this audio podcast, is basis where Hussain, a science student, looks at where within this investigation, histopathological methodologies, including tissue processing, hematoxylin and eosin, or referred to or abbreviated, as H&E, staining and quinone carbofusion or KCF staining were utilized to visual were utilized or were utilized or used to help visualize the pathology or elements of the pathogenesis of a patient X's pulmonary on patient case with pulmonary lobectomy specimen. And the sort of aim of the investigation was to establish or determine if the patient case had been infected with tuberculosis, M being abbreviated for mycobacterium, so M tuberculosis, sort of the causative agent or basis that gives rise or suspect to tuberculosis or TB in humans, and through where the science student Hussain investigates his patient case by informing of and employing and by also implementing the use of hematoxylin and eosin, H&E, and quinone carbofusion stains, a particular sort of histopathological and sort of cytology and sort of microbiology, if you will, sort of staining investigations. H&E are H&E or hematoxylin and eosin are formally sort of two broadly and sort of basic sort of laboratory staining investigations used together to inform of the cellular morphology. That is to say, viewers and listeners, that it's where H&E staining investigations help laboratory investigators to better understand or better to better understand and better sort of investigate sort of the cellular morphology of tissues and cells by and through where H&E investigations or stainings, laboratory stainings, help sort of bring out and differentiate, if you will, the abnormal from normal under as part of under microbiological sort of investigations additionally, and hematoxylin stains, laboratory staining investigations, and generally negatively negatively charged cell components. For example, within pathogenesis, such as the nuclei genetic material purple, where it brings out sort of a purple and blue tinge to particular cells, under microscopy. And to provide a sort of a contrast, a sort of compare and contrast basis, eosin laboratory staining positively charged stains positively charged cellular components, including the extracellular matrix and cytoplasm and connective tissues in varying shades of pink, in various shades of pink staining. So, for example, in where hematoxylin, for example, again, hematoxylin stains negatively charged particular cell components. So investigators can morphologically sort of appreciate sort of cell bases under microscopy, and eosin does the opposite. So therefore, under microscopy, generally speaking, it is where the particular cell components are and can be sort of elicited and sort of understood by laboratory investigators. At the same time, H&E staining can thus be used to display or inform of the range of cytoplasmic and nuclear and extracellular extracellular matrix features under microscopy. Additionally, to inform where science student Hussain informs on this sort of particular patient case, is where granulomatosis inflammation. Inflammation is a sort of a hallmark of cell injury caused by tuberculosis, and distinctive mononuclear leukocytes, and particularly viewers and listeners on those leukocytes, those particular hematological components, the leukocytes, being macrophages in this case, respond to cell injury by accumulating in infected tissue infected tissue sites, and multinucleated giant cells are also additionally found in granulomatosis tissues, and are typically characteristic of inflammation. And these are noteworthy, or they're important, because these are sort of inform or demonstrate the sort of features that are of concern when diagnosing, when there is a sort of a diagnosis in around a TB or tuberculosis, and can be established and identified by laboratory investigators by the use of hematoxylin and eosin laboratory staining investigations. At the same time, then there is a basis of other particular components, that are also additionally important. But that draws this audio podcast to a close. This audio podcast is part of the Haemotoxy. This audio podcast is part of the Bostics and Baraga. This audio podcast as part of the specials. This audio podcast is part of the Express and the Caliber. This audio podcast as part of a Storm Robotics production.